How are you, Dental Marketing Philippines subscriber? How are you, Dental Marketing Philippines dentist? I'm back. I'm Mr. Roche Pervis, and I'm here to give you just like a platform for you to be able to learn a lot in terms of marketing, in terms of your discipline. And today and tonight in other countries, good day. It's a great day today because this is an opportunity for us to learn about geriatric dentistry. But before we proceed with geriatric dentistry, I just like again to make mention that you can subscribe, you can like, you can just press get started from Dental Marketing Philippines page. Don't hesitate to share, don't hesitate to really like, comment, and you can also ask questions as we go along with the presentation. As you can see, our guest speakers is already there, but we're gonna hold it for just a few minutes, and I'm just going to continue with who is dental marketing, what we do. So basically, we give dentists or even doctors or even other organizations, even a product or even your clinic to give you tools that will definitely aid your practice. So this is an avenue. This is a great opportunity for each and everyone to have this kind of system. Now, we have provided several lectures already. I would just like to reiterate. I would just like to give you a brief review. So last April 7, we had great discussions with Philippine Dental Association President. We were able to get to know all the programs. We were able to get to know the leadership in time of crisis. And we were able to ask the Q&A with your president. So nalaman po natin that they are doing a lot for their members, for you, dentists. And also, I had a lecture in pandemic, its effect to your dental practice and dental business. In here, I'm going to show you a few slides on this presentation also. And we were able to learn also about what do we need today. So boost your immune system and also telemedicine. So right now, they have been doing a lot of telemedicine in the US, but in the Philippines, probably this is the right time for us to do telemedicine. As we are now, you are in the dental world, probably you are doing teledentistry also, right? So then yesterday, it was a great avenue again, great learnings. We were able to talk to Dr. Matthew Gillespie and an alternative approach to traditional dental model using minimally invasive biomimetic restorative dentistry to build a value-based dental practice. So he have taught us how to be to be like a businessman doing all of this insurance or giving services without getting more patients but getting more income. So that's a great avenue. And tomorrow, today is April 17 and tomorrow April 18 in Manila, we're going to have Dr. Arturo Pavia. He is the president of Global Dent USA. So we're going to talk about anything about bleaching, everything about it, cases, and other materials. And today, now, you tune in, you share this video, and you can ask questions later. The webinar will be focusing on the provision of geriatric population. I'm also very excited with this. She's a good friend of mine, no? So we are physically distanced, but we are socially inclined. So physical distancing, but we are not socially distant. Okay, so yesterday, last April 10, I also discussed about the exposure of dentists. It's 95% exposed to diseases and 99% proximity rate with you, patient to dentist relations. And also this one have been discussed. So what to do during the pandemic period? I have three things. Number one, today you learn to do marketing. So marketing is a great avenue for you to learn and hone your skills in planning for the next 2021, for the next year, no? And you have to enhance your discipline by learning a lot in attending webinar, no? So again, we're providing this free. I've sort of all of my connections and my friends to just beg them to give them you a good presentation. Then phase 2, after the enhanced community quarantine, we have to think, we have to pray, but you have to relax and get back to work slowly. Don't rush yourself to get the sales traction right away. Slowly, you can build up your practice again. And number 3, on the recovery period, that's going to take us quite a while. You have to be patient. You have to stay focused and have a fresh graduate mentality. So you have that kind of mentality. And right now, I will now definitely welcome, our guest for today. She is no other than my geriatric tooth fairy. So let us now talk to our guest. And before she proceed with her great presentation, Dr. Sonya Dunbar. Sonya, how are you doing?
I'm
I'm
amazing. Thank
amazing.
you for
Thank you for
asking.
asking.
Yeah, can you give us your greetings to all the Filipino viewers, to those who are watching at their home, who would want to learn about mobile dental program or your geriatric program that you have? Although it is going to be part of your presentation, but just give us a glimpse of what you have inside your slides.
Absolutely.
Absolutely.
Thank you for the
Thank you
great
for the great
introduction.
introduction.
My name is
My name
Sonya
is Sonya
Dunbar.
Dunbar.
I've
I've
been
been
have had my
have had my
mobile dental
mobile dental
company
company
for over
for
four
over
years
4 years
now.
now.
Wow.
And my
And my
specialty
specialty
is the
is the
geriatric
geriatric
and
and
nursing
nursing
homes,
homes,
long-term care
long-term care
facilities.
facilities.
So in
So
this
in this
slide,
slide,
I'm going to
I'm
talk
going to talk
about
about
mobile
mobile
dentistry
dentistry
and
and
different
different
aspects.
aspects.
I'm going to
I'm
hit
going to
on
hit on
pediatric,
pediatric,
special
special
needs,
needs,
and just
and just
corporate mobile
corporate mobile
dentistry as
dentistry as
well.
well.
What it
What it
costs
costs
to start
to
a mobile
start a
dental
mobile dental
company
company
and to
and to
maintain that.
maintain that.
And
Mm-hmm.
then
And
I'll be
then I'll
open
be
to some
open to some
questions.
questions.
I'll also
I'll
hit a little
also hit
bit
a little
on
bit on
teledentistry
teledentistry
and
and
how
how
mobile
mobile
dentistry is very
dentistry is very
effective.
effective.
Now, I was
Now I
looking
was
at my
looking at my
Facebook
Facebook
page and I'm
page and
like
I'm like
9,000 miles
9,000
away
miles
from
away
you.
from you.
So
Yeah.
it's
So
pretty
it's pretty
cool.
cool.
But
But
mobile
mobile
dentistry is
dentistry is
pretty
pretty
big here
big here
in
in
America.
America.
So I'm
So
hoping
I'm
to
hoping
share
to
a little
share a little
insight of what
insight
we're
of what we're
doing
All right.
doing
here
here
and see if
and
it's
see
what
if
you
it's what
guys
you
are
guys
doing
are
there as
doing there
well.
as well.
Okay. Yeah. So we will hold for it's getting interesting right already. But before we proceed with before I formally introduce you, I would just like to show you one slide, huh? Then you tell me something about this, Sonia, huh? This
I
might be a
can't
I
see any
can't
surprise to
see
you,
any
slide.
but
slide.
yeah, this slide. Uh, yeah. Can you see this?
I don't
I
see a
don't see a
slide.
slide.
You don't see a slide.
No.
No.
You don't see a slide. Anyway, this is Sonya Dunbar. We've met each other in Boston, Massachusetts. You've seen that? So
I
anyway,
can't
I
see
can't
it.
see it.
yeah, you can see it. Okay, it's okay. So we're now going to proceed with me introducing you. Okay.
Thank you.
Thank you.
Okay. So, ladies and gentlemen, for all the viewers out there, this is another, as I said earlier, a great opportunity for the dentist in the country to learn about how lucrative is geriatric population in terms of dentistry. How we're going to get more earnings. The main mission is really to give out your services to really give senior citizen or geriatric patients with a great smile again. And she has been in the practice for quite some time. She has been doing this, and she has a mobile dental program. She's even doing a lot of mobile geriatric system, and at the same time, she is the founder of Geriatric Tooth Fairy. Actually, and SOS Senior Citizens, Saving Senior Citizens. This is a program that she introduced in America and getting its ground. We're very happy that we're going to learn from her today. And she is no other than Miss Sonya Dunbar, the Geriatric Tooth Fairy. Ladies and gentlemen, Miss Sonya Dunbar. Sonya, go ahead. You can
Thank
start
you.
presenting. Thank
Thank you
you.
Thank
for
you
a
for
great
a great
introduction.
introduction.
So, like was said, I'm going to start out talking about geriatric mobile dentistry. Just to talk a little bit about a couple of points we're going to hit on. We're going to talk about access to care for the underserved, just the philosophy behind mobile dentistry. And we're going to talk about, again, how to establish a profitable mobile dentistry team. We're going to talk a little bit about teledentistry, and we're going to hit a little bit on the challenges of a mobile dental company. Just a little bit about mobile dentistry. Some people think that mobile dentistry just came around, but mobile dentistry has been around for a very long time. It started back in the 18th century, in the early 1900s. In America, mobile dentistry was used by our military during the wars because a lot of the soldiers would get sick because of mouth infections and abscesses. And they had to send dentists out in mobile military trucks to go and take care of the army and the soldiers that were on the field. So mobile dentistry is nothing new. It's been around for a very, very long time. But now it seems like it's coming more to the forefront because people, especially where we are, like to be catered to a little more. So mobile dentistry seems to be coming to the forefront also in the underserved areas. Mobile dentistry is very much needed. So I just wanted to put a little bit of history in about mobile dentistry because it's nothing new to us. It's been around for a while. Here, mobile dentistry has a lot of faces. There's school-based mobile dentistry where you go to the schools, and it's very big in high schools and in elementary schools because a lot of the parents work and they don't have time to take their children to the dentist. And a lot of dentist offices are open during school hours. So it's been a proven fact that it's good to have school-based dentistry. And sometimes that's the only place you can get some of the kids because, like I say, the parents won't bring them to the dentist. So school-based dentistry is very big. Special needs dentistry is a special type of dentistry. A lot of the people who have special needs, who may have um, dyslexia or Down syndrome, or they're confined to a wheelchair, they do not have the access to get sometimes to get in and out of the dental office. And sometimes they don't even have the transportation to get there. So mobile dentistry is very good for that population as well. Also, we cannot forget corporate mobile dentistry. That is huge here, huge, where we have dental vans pulling up to corporate offices, um, big chains where employees work and they don't want to take off of work and they can come down and maybe get dental work done, such as a simple filling on a lunch break or a cleaning or crown prep or even a root canal. They're doing this right at people's jobs. So sometimes you may not ever get a dental person to walk through your door, but you could bring the door to them. And that has been proven to be very lucrative here. Just regular comprehensive dentistry in a mobile unit. Also, with that mobile unit as well, they have also been able to go to addiction centers where people may have issues with drug addictions and their mouths need additional work, and so the van could stop in front of some of those facilities and take care of that. We have mobile dentistry that just go to people homes. Of course, now right now is not a good time to be going to someone home or even to their jobs. But soon as our world heals from this pandemic, this is proven to be a very lucrative way to provide dentistry. Homebound. We have dentists just pulling up in front of people's houses and they're coming out and getting their work done. Another big type of mobile dentistry is whitening dentistry. We have people have mobile vans and they just go to people's homes. They go to their jobs. They pull up at bridal showers, bachelorette parties, and they do whole whitening parties. And they do whitening for people. And then, of course, my favorite, which is the geriatric mobile dentistry. So we'll hit on a snippet of each one of those to give you a little insight into the mobile dental world, which is my world that I've been in, and I love it. I love mobile dentistry. I would hate to go back to a brick and mortar building now. There's nothing wrong with brick and mortar. We absolutely, positively need that. But my world has now become mobile dentistry. This is just a quick look at what a typical fancy mobile dental van might look like for a school-based dentistry. As you can see there, we have the front and back entry here where the kids usually come in. There's one or two operatories right there, and then they can exit right out the back. This would pull in front of an elementary school or even a high school, maybe not, but definitely an elementary school, and provide that care for those children. Right out front here, we would have the registration desk where the people would set up to make sure we have the intake forms. Most of the time, the intake forms are done before the mobile dental comes. The forms are sent home with the children to their parents at either or They're done at the beginning of the school year and letting them know that the mobile dental van will be there. So this is just how one of the vans may look. This is kind of fancy. Not all of them look like this, but this is a pediatric school-based mobile dental unit. And typically this may have maybe a dentist, an assistant, and then the driver. So you can already see how this could save you because you don't have a whole big office staff there. You just have the basic raw team, maybe one or two assistants there. Now, inside of these amazing vans, what we're basically doing is dental screenings, just a screening exam, fluoride, varnish, applying sealants, and we're doing simple cleanings. They don't typically do pulpotomies, and they maybe do a simple extraction if needed, but just the basic dentistry for children. If there's something that may require a little more time, a couple of maybe an hour or so, they typically refer them to an office. We're just trying to meet that need to help prevent a lot of decay and get the children seen in the school base when we're coming there, giving them toothbrushes. And it's so important to talk to the kiddos about proper oral care. So this is something that is amazing for the school base, and the kids like it. This is one of the screenings where you can see over here where they're doing their screening on the little kiddo there, and she's liking it, and maybe an x-ray. And this is how the inside of a van may look. It's not that big, but everything, as you can see, everything that you may have in a regular dental office, you'll have in that van, which makes it pretty cool. Just something for the kiddos to like. I really enjoy seeing children get proper dental care that's needed, because we hate to see the kiddos get and have a lot of pain. See that's the pain that I'm talking about. Tooth decay is the most chronic condition affecting children in the United States. It's a chronic condition that can be prevented. To me, that's what makes it so bad, because it can be prevented in our kiddos. So in a lot of kids, poor oral health can have a detrimental effect on children's quality of life and their performance in school. If their teeth hurt, they can't perform good in school. They can't eat right if they're having pain with their teeth and they miss school. Children with poor oral health were nearly 3 times more likely to miss school due to dental pain. And that's just a study that was done on that. And school sealant programs provide sealant to children with lower income. So school-based dentistry has been proven to be very effective in helping children keep a healthy mouth and not miss so much school and not be in pain. Just looking at this baby mouth, it hurts my heart, because we all know as dental professionals that this probably started he looks like he's young, all just a few, not even missed 2 maybe adult teeth, but he probably had nursing mouth. He probably, had the nursing teeth where he had sucked milk too long and his teeth were decayed really young. So this is something that we would like to prevent and educate the kiddos and their parents about proper oral care. So school-based dentistry has proven to be very effective mobile dentistry, because some of these children, like I said, would never walk through our office doors. We may have to have them walk through ours. Next, we want to talk about special needs dentistry. It takes a special type of dental provider to take care of someone with special needs. And I'll just put that right there. And there are many faces of love. This type of mobile dentistry takes a lot of patience. It takes a lot of time, and it has to be a desire. As you can see, that this mobile provider is actually in this young person's home that has special needs. Sometimes in a mobile dental situation, it's not always the van. You're actually taking all your equipment to that location and providing mobile dental care. And I see that quite often. This is a mobile unit that's kind of roomy and set up for someone that may be in a wheelchair here. So You got to kind of have, this is a little more in depth because you got to have certain restraints and different things like that. So this type of mobile dentistry takes a special type of dental provider. And here again, children with special needs, they have a higher risk of gum disease and oral trauma because they tend to fall more and they tend to have tooth decay, and many have a hard time getting to the dentist, just like because of the wheelchair situation, and or they're walking, they have a hard time getting to the regular dental office. So taking dentistry to them can prove to be very effective. It's a very effective part of mobile dentistry. I was able to meet an amazing mobile dental provider, Dr. Brooke, out of Colorado, I believe, or Oklahoma, and she provides amazing mobile dentistry, and she has her whole team, and it's a labor of love. Truly, it is. It is. So that's just another type of mobile dentistry. And then we have the corporate dentistry. Mobile dentistry is just not for the underserved population. We have a lot of dentists that are providing whole comprehensive dentistry in a mobile unit, and they're taking it to the streets, and I will have the great privilege, because I do provide mobile dentistry, to meet some of the best mobile dental providers that I've ran across in our country, and they actually, a lot of them don't only serve the underserved population. So I want to be clear here. There's two aspects of mobile dentistry. You could have the aspect where someone's just providing care for the underserved population, or you have the aspect where someone is just taking their whole brick and mortar dental office and and taking it to the street. They're, instead of doing it in a building, they're doing it in the van. And some dentists do both. So that's just a luxury that you can have there. And this is a example. Some people, like I say, some patients may never walk through your office door, but it'll allow you to walk through theirs. And this is Dr. Watson, who is a great inventor, and he has what you call care dental. And this is his van, and he has two vans where he actually pulls up to someone's house. He actually does root canals, he does extractions, bridge work, everything. He also pulls up in front of major locations where he's contracted with these companies, and the different employees come out and get their dental cleanings, their dental fillings, composites, resins, everything, and they're just taking it to the streets, and this helps reduce people missing work. It helps keep the work hours up, because employers usually work with these people to let them take different breaks and different shifts according to what their dental care is, because the people have the insurance. And imagine how many people, if they have dental insurance, don't even use all their benefits, because they don't take the time off work to come to the dentist. It also helps prevent emergency room visits. If we can catch some of that stuff before it becomes an abscess, or before someone's up all night, and prevent them from going to the emergency room and getting that taken care of. A lot of people kind of, put off coming to the dentist until it hurts. But if we can bring it to your job, and you can come downstairs, get a simple filling, a composite, or whatever, and go back to work, that would be great. So this is a very big trend, and Dr. Watson has kind of niched that, and he has his vans, and they're out, and he's been able even to provide some emergency care during this pandemic. He's busier than ever right now. So that's, hey, people have an emergency, you got to be seen in the emergency room. It's only going to treat the symptoms, unless they have a dentist on call. And how likely is that? So moving along, which is my favorite part, which is geriatric dentistry. And this is my wheelhouse. And that is my beautiful mother-in-law. On the front there, I had to put that on there because I love my ex-boyfriend, which is my husband. But anyway, I have the best mother-in-law ever. She's a mother of love. So, but geriatric dentistry is my platform, and this is the wheelhouse that I work in. By 2020, which is here, they said there'll be over 55 million people who will be over the age of 65 years old. And that is one of the fastest growing one of the fastest growing groups is the aging. Their people are just living longer. By 2030, they say 1 out of 4 people will be older people, and 1 out of 10 residents in long-term care facilities will die from aspirated pneumonia, which is directly linked to poor oral care. So this is just someone who's providing mouth care for someone in a nursing home. A lot of people, once they get to the nursing home, they have a hard time getting out, simply because if they're in a nursing home, they usually don't have a family member that can take them back and forth to the dentist. And if they have to go out to the dentist, then most of the time they can't go alone. One of the nursing staff, if the resident doesn't have a family member, a nursing staff has to go with them. And that takes people out of the building. It's also there on the payroll. So it becomes a issue where it's just more convenient to bring people exactly to the nursing home. This is a vulnerable population. Right now, COVID-19, a lot of our elderly people are falling victim to this plague, this virus. God bless them. Yeah. So I'll just put that right there because it gets me really emotional. So some of the leading causes of death for the aging population in long-term care facilities is heart disease, cancer, chronic lower respiratory disease, and aspirated pneumonia. And most of these, like heart disease, aspirated pneumonia, even cancer, all of these have been linked to poor oral care. I know I'm singing to the choir here, but this is just some of the reasons why geriatric oral care is so important. We know the systemic links to poor oral care. This is actually one of my residents that at a nursing home that just recently requested before the pandemic that we see him, and this is his mouth. This is a regular mouth in a long-term care facility. And it just needs work. Here again, some more of the systemic leak: aspirated pneumonia, cardiovascular disease, diabetes, UTI, dementia, which is Alzheimer's, and even weight loss has been directly linked to poor oral care. And all of these chronic conditions are prevalent in long-term care facilities, which compromises the residents, which is probably reasons why a lot of our vulnerable, frail adults are getting sick, because they have these comorbidities, and that makes them more susceptible to COVID-19. So it's imperative that we provide proper oral care for, to me, which is part of our greatest generation. Here again, singing to the choir. This is the aspirated pneumonia that's directly linked to our mouth, which is a silent killer. In America, that is the #1 reason why people in long-term care facilities go to the hospital, is because of aspirated pneumonia. So we have to get a hold on this oral care condition with our vulnerable aging population. Another reason why mobile dentistry is great in long-term care facilities is cancer. This is one of my residents who had here this cancer on her forehead and a little cancer on her nose, which we seen when we went in to see her. How about that? So dental professionals, we're up in people's face. We can see some things. And I've even had patients that been looking in their mouth. One lady, her daughter didn't want her to see our team because she didn't have any teeth. And she said, my mother doesn't have any teeth. She's 79 years old. She doesn't need to see the dentist. I said, well, you know what, ma'am? She has a mouth. And everybody with a mouth needs to be seen. Well, the nurses look in her mouth. I said, but the nurses aren't dental professionals. Let a dental professional look in her mouth. So, and we go every month. So it took her a couple of months to allow me to look in. Cancer on the back of her tongue. Yeah, close to the back of her throat. We discovered that. And we helped save her mother's life. And she was ever so thankful for that. Morbidity rates are higher for older adults, with approximately 70% of all cancer deaths occurring in people over the age of 65. One quarter of new cancer cases are diagnosed in people ages 65 to 74. More than 70% of the morbidity associated with many cancers, including prostate, bladder, colon, pancreas, stomach, rectum, and lung, occurs in people over 65. So, you know, cancer, it just, it happens to everybody. It doesn't pick and choose, but it seems as if you're older, you could be more susceptible. So it's important to look in our aging adults' mouth in the long-term care facilities. So that's my buddy there. She's doing well. She's doing well right now. She had a little bruising, but as you can see, she likes her little red bonnets and her little red bows in her hair, and she's a jazzy lady. And I just like this picture. I just thought the picture was cool because it kind of demonstrates how the bacteria, like I know I'm talking to doctors, but the bacteria just comes from under the gums and affects all the organs. But this is just, you all have to admit, it's a cool picture, right? So I just got it on here. But we all know the systemic link to oral care and the mouth. So that's just why that's there. The heart and everything, the lungs, and a lot of that can just come right from the bacteria in the mouth. Healthy mouth save lives. That's my story, and I'm going to stick with it. Okay. Service residents where they are most comfortable. So to be honest with you, when you're in a long-term care facility, most of them do not have a place set up for a dental office. So most of the time, the people are already in they're in their bed. They're in the Geri chair, which is the upright chair with the lady in the pink is there, a wheelchair, or not every place is ideal. I've worked in I provided dental care in bathrooms, shower rooms, back of hallways, wherever we could set up and get the area sterile. That's what we were, and to kind of close it off for privacy. Most of the time is in the beauty salon, if it's available, but also always in nursing homes, you're going to have people that are confined to their bed. Some people just don't get out of the bed. Some people are comatose. They don't even know you're working on them, but it needs to be done. Some people are next to you and you'd have to kneel next to their chair. And here I am with a lady in a Geri chair and you have to stand up. So it's not the best on our body, but dentistry isn't anyway. It's not the best, what they call aerodynamics or whatever they call that. Aeronomics. I hope I said that right, but it's just not the best, and it's even worse when you're providing care in long-term care facilities. Now you can actually take a van to a long-term care facility and that works, but you got to think about it like this. It depends on the climate. It's just hard taking seniors out if it's raining, if it's cold, if it's hot, and it's hard to get them out into a mobile unit, but it is being done. A lot of seniors don't like leaving the nursing home. They don't like going outside. They're scared. And then if once you get them in there, if they're in their wheelchair, you have to make sure that's okay. I don't feel comfortable providing mobile dentistry and with geriatrics in the van, because if something happens to them, then when you're taking them out, then you're liable for that. So I just like to service people in the comfort of their own home. And that nursing home is their home. That long-term care facility is their home. And I respect it as such when I walked in. When I walk in, I know that I'm walking into someone's home. I knock on the door before I go in any room. I ask, can I come in? I respect their home and in their environment, because this is theirs. We do x-rays. You have the Nomad that's portable to take into. Now, these are old pictures. Don't be saying, well, he'll mask it on COVID-19. These are older pictures, but still I should have a mask on. But I just wanted to smile so y'all can see my teeth. So, but I would usually have a mask on, but I did want to smile. And I got that one glove on, but I just wanted to look cute. So, but we do all of that in there and take those pictures in the nursing home. And we do dentures. That can be done. Dentures take a little longer because we go once a month. So 1 month we take the impression, then we come back. Then the next month we do the bite, just the wax try-in and different things like that. So it usually takes about 3 to 4 months for a resident to get a denture, but they seem to be pretty patient. And we go in there, we do denture cleanings, partials, fillings, extractions. Usually in nursing homes, we don't do any root canals or bridge work or anything like that. But our dentists that work for our company do comprehensive dentistry outside of implants and things like that. but I know that some dental companies do that in long-term care facilities, but that's just not something that we do. Here again, it's just another tight situation where you're leaning over the bed and here, and then you got somebody, we had to use the rec room. You may have to use a rec room in there, and you just kind of making it happen, doing an oral cancer screening here. Not the best on the back, working in tight spots there. That's just the nature of it. It's just how it is. This is a perfect world. If I had a perfect world, even this young lady, she's in a beauty salon. You can see the hairdresser, the hair dryer is back there. But this particular facility had a platform where you can actually put the wheelchair on and it kind of lays the patient back. And she's able to roll her supplies in there and just work on the residents right there in the comfort of their own wheelchair. Because I'm going to tell you, elderly people do not like getting out of their wheelchair. They do not, it's scary to them. Some of them, because most of the time they have to have a lift or a hoarder if they don't have strength in their legs. And people have a fear of falling. I don't want to fall. So they don't like getting out of the wheelchairs. That's one of the reasons they don't like going to dental offices, because they have to get out of that wheelchair to a dental chair unless a dental office has a space where there's no chair, because you can't, it's just hard. It just doesn't fit. Unless you have a really big room with the dental chair in there and then a wheelchair, because most dental chairs are stationary. So that's one of the reasons why geriatric dentistry for seniors in long-term care facilities is best provided inside of the facilities. In the mobile vans, I know that they don't have a chair, so those wheelchairs roll in perfectly and they're able to service the people in the van. And some vans actually have this in there. So that works, it really, really works. Here's the equipment. Um, what equipment is needed for geriatric mobile dentistry? Then you have a chair, because you have some people that do walk, they're on walkers. You could put them in a chair. This is the chair. You have the bag that everything comes in. You have your light and this is a different type of camera. All your supplies are in here. You're able to pull it. Here's a chair. Most of the dentists don't sit in a chair. They kind of just kind of bend over, but this is the chair. And, therefore, these pack into a van and must be uploaded and set up and unpacked at site. It doesn't take 3 to 4 hours, but you're usually packing and unpacking and sterilizing. Now that usually takes and doing all your records, that usually takes about 3 to 4 hours from prepping. So when you plan your day, you got to kind of plan around that extra prep time to disinfect the area before you start, to infect after you leave, to set up, break down, disinfect all your stuff. You have to have a flow. But this type of equipment is it's not that very expensive as it compares to a stationary dental office. More equipment. Now, this is kind of what my equipment looked like. I wish it looked like that fancy stuff, but this is more realistic, like what what our equipment kind of look like. And then you have these equipments here, just to show you these are easy to transport. You roll them. Most things come on reels. Nomad, you need your laptop to put your notes in and take your x-rays and all. We have like an extraction box. We have a denture box. We have, each box has a label. You also have to practice all the HIPAA laws and OSHA laws are applicable to mobile dentistry as it is to stationary dentistry. You have to make sure everything is up to snuff with that. There's no shortcuts, just because it's mobile dentistry. So that's how we roll. And it's heavy. So I'm getting my muscles in. So Dr. Watson, who I showed earlier, his caravan, he invented this amazing x-ray jacket, and the dentist can use this. It is lined with the radiation blocking material, and the outside is washable. So you can keep this on. You can actually keep this on while you providing care. It's lightweight. It's not heavy. I wore it, and you can do the service. And as you can see, you can do the dental care. And as you see, he's also taking x-rays. So that keeps you protected, and it keeps you covered from radiation while you're doing mobile dentistry. And it's designed just for mobile dentistry, and it's about $400, which is not bad for something that you can use for a while, because lead line aprons cost a couple $100 anyway. So I think it's a great invention, and I think it's just a great product to have to cover yourself and your patients that you're providing dental care for. And here's some breakdown on pricing. Um, a mobile dental unit, the Dr. Quam's mobile dental unit that he does sell. His unit costs about $150,000, whereas the average setup for building a dental office with 3 chairs could cost close to $500,000. Once you own your mobile dental, you have no lease. But if you rent and you or buy in or have a mortgage, it's probably about $5,000 a month. Capital for mobile dentistry, the capital equipment, all the equipment usually comes with it. Let's use a one bang buck. Capital, once you build your business, could probably run you somewhere around in here, give or take. Estimate for the mobile van, you have to pay for gas, which is probably about $12,000 a year. Utilities with a dental practice, probably about $11,000 a year. So you just swap for a swindle there. With the mobile dental van, you have a smaller staff. Most of the times your office manager can work from home, do all the billing, and get the insurance information from home in her jammies like we're working now. And so that could cut down on her salary, because if you're working from home, maybe you could negotiate that, and you maybe have to have 1 or 2 assistants. Unless you're a hygienist that owns a mobile dental company, you don't have to pay a hygienist. I don't know if you all have hygienists over in the Philippines, but if you don't have a hygienist, that would probably be a salary there for your assistant. And over here, if you have an office manager, a hygienist, an assistant, you could pay $150 and upwards for staffing. These are ballpark figures, nothing hard etched in stone, because all of these are flexible. If you just rent a storefront or whatever, you can make that a little less. But I'm not saying that mobile dentistry is better than the brick and mortar either, or I'm just trying to put the prices out there so that you can see the difference. And this is Care, Dr. Watson's van, and he has 1 chair in there. This is how it looks, and he just goes, and he has 2 of these vans, and he just goes right to the house and provides that care right on site. The people come in easily disinfected, everything is washed down, and it's pretty neat. He also has some sort of a compartment that he's invented to keep the cold things cold, the hot things hot. So it's temperature related. So if you live in a part of the country that's really cold, your equipment or your lines won't freeze over at night. And if you live in a part of the country that's really hot, it won't be affected as well. So this is his van that's $150,000 out the door. He's also invented what you call the Care app, which I really love, which makes it easy because it lets you know, it lets the patient know that you're en route there. It makes sure their insurance is pulled up, that your office manager put in. It lets you know the location you're going to. It lets the patient know that how close you are to them and what services are being done. It's just an amazing app that he invented with his van. I'm a huge fan of this, and this is his contact information. It probably won't get a van over where you all are because it's like 9,000 miles away, but just had to put it in there. Also, the app helps with billing. It also helps with when he goes in the area. It's just so much that this app does. I think it's pretty cool. I also want to show you another model of a mobile dental van. It looks something like this. And here's some other things that I didn't mention about the van. This van has a 2-operatory. This van is a bit bigger than Dr. Watson's. It runs about $300,000. Also, when you have a mobile dental van, you have to take into account that you have to cover maintenance. Well, you have to cover maintenance in a building as well. You have your insurance, same in a building. You have to have insurance, but you have to have a place to park your van where it's safe. Your building doesn't have to be parked anywhere, and you have to have a competent driver. So that's something that's really important. You have to have a driver that you can depend on, because a lot of times the dentist doesn't want to drive and work, and then you don't want your assistants driving. So unless you do, but you do have to have a good driver, and it needs to be designed for a disabled access, and it has to be efficient and move and management to be able to keep the patient. You have to have everything to keep the patient's stuff confident. So it's good if you have like a laptop and you have all your information in there. It's not good to carry files and different things around in your van. But this is a different type of van that I wanted to show you, another type of mobile dental unit. Teledentistry. The bottom line about teledentistry is cloud-based HIPAA compliance technology coupled with innovative teledentistry platform, affordable intraoral camera. This is the program that I use. And this is something pretty great because the dentist, like Dr. Watson, he sends his assistant out before COVID. You know, he's still going out now, but he's just doing emergencies. But he could send his assistant out to do an exam while he's at home and can see what's going on. He can treatment plan. They can send it to the insurance, and then they can plan and get everything set up, and then they can plan when they're coming back. And this assistant can do many of these in one day. She could just ride around and do these intraoral exams and make her day productive and set up these treatment plans and plan to come back. And you could do these right at people's homes, on their jobs, or even in a brick and mortar. When we post COVID, we don't know how our patients are going to feel about coming back in the office, where you can have your dental assistant in there to have people waiting, and they can wait outside in their car. So it won't be a gathering of people in the waiting room. Dental assistant can call, come right in, get in the chair, do an intraoral exam. You know exactly what's going to happen when they come back. Treatment plans or whatever. That way you can also separate the people that you're going to do have aerosols with and different things like that. I think teledentistry is just epic. I think it's a new way, and it's huge here. When in the nursing homes, we're able to send the mouthwatch camera in and give it to the CNAs. There's a problem, you know, what they may think is a problem, what they may think is a dental emergency, you know, we know, but it's not always a dental emergency. So we can assess that and see if we have to just prescribe something, or is it a true dental emergency. We've had to go and do a couple of extractions during this time, which were true dental emergencies, but this has saved us. I know one lady was like, oh, she broke a tooth. It was just a chip. Okay, so no, that was not a major dental emergency. It was a chip, and it was cutting her tongue. So we was able to take care of that over the mouthwash. And don't rub your tongue over that too. I'm just kidding, but that was not a dental emergency where you have to send someone in. That's not what the ADA is calling a dental emergency here. So I couldn't do this without plugging something about teledentistry, because it's been great. And I think it's going to, because of this pandemic, I think it's going to change a lot of the way that many people do dentistry now, and make it way more convenient for us to provide a more efficient way. But it's huge for geriatric dentistry. Even, let me give you a good scenario as well. If you have someone's mother in a nursing home, and you can just snap that picture and send that to them by email, by HIPAA compliant email, if they've signed a release, if they're their power of attorney, and you can say, listen, this needs to be happen in your mother's mouth. So that's a treatment plan that you can do for someone that may not be near that area, and their mother is in a nursing home in another city. So that's another way that teledentistry works. Also, the dentist can make a face-to-face conversation with the video right there, and be in the room with the resident doing an exam with their family member, watching and seeing what's going on in their mother or father's mouth. So teledentistry is huge. It's really huge. This year, we were able to host our first National Mobile Dentistry Conference. We held it in Orlando, Florida. It was February 28th and 29th. I mean, we got in right before this pandemic really got crazy. We're doing it again next year in Orlando, Florida, March 4th and 6th, but 4th through 6th. But we had people from all over the country coming together that did mobile dentistry. And this was so important because mobile dentistry is lonely to me, because when you have an office, you have a little family. When you're in your office, everyone there is like family. You change the Christmas gifts, is lovey-dovey. You have a family. You know, you work with these people for so many years. But in mobile dentistry, it's probably just a dentist and an assistant going out. They don't have a one set office that they go to when they leave the nursing home, or the kid, the van, or when they leave the school-based dentistry, they go home. So sometimes mobile dentistry could be lonely. So we were able to bring people together, and it was just like a big family reunion, because people who provide mobile dentistry are seem to be very compassionate people. We're not saying that all dentists are not very compassionate, but it's just, it takes a special type of person, especially if you're going to serve the underserved population. But we had some, like I say, some dentists there that were not just, they weren't only serving the underserved population, they were serving just corporate dentistry and doing comprehensive dentistry there. From the National Mobile Dental Conference, we formed the American Mobile Dentistry Alliance, and we do have an international chapter where we come together and we collaborate and we make different rules and just collaborate with about mobile dentistry and making this one big unit. So this is the bigger and better thing that we're doing here with mobile dentistry. And this is the name of my husband, Gerald Dunbar, and our mobile dental company is called Mobile Dental Express. And we provide dental care for residents in long-term care facilities. So we got little wheels on there, some rims, because we be rolling. Now, we're the kind, we don't usually take people out of the van. We usually take stuff into the nursing home, but we will be getting a van for people who will need more extensive work that the dentist wants to do in the van. But right now we are providing care inside of the van. That's me on a very, very good day. Because here it is almost 11 o'clock at night. I used to go to bed at 8, but that's neither here nor there. I just want to talk about my book that I wrote called Golden Nuggets of Life. It's just about little stories that people told me while I was in nursing homes, providing amazing dental care. And so many stories go to the grave, and I just didn't want that to happen. It's available on Audible, Amazon, and iTunes. Also encourage people to watch my TED Talk. I just did, I don't know, TED Talk is worldwide. I did a TED Talk in January talking about the oral care condition that goes on in long-term care facilities. So if you wouldn't mind, if you go to TEDx and type TED, go to TED.com and type in Sonya Dunbar, you can watch my talk. It talks about nursing home oral care. It's about 15 minutes long, and I think it's pretty amazing. And also we have an app. And this is just to be in the loop of what's going on with geriatric mobile dentistry in America and with us. And that is the end. Thank you for being so patient and allowing me to share my life story. Are you still there? Hello? Okay. Did I lose you? Let me text them. Hello?
I had a problem with my. Yeah, there you go. So yes. All
Did
right.
I lose you?
So again, Miss Sonia, I do have several questions in here. It was actually PM to me by some of the friends that are watching right now. So you
Did,
also
did you
do
did you see the whole video? Did you see the whole
basically.
video?
Can you hear me, Sonia?
I can hear you.
Okay. So you've been doing a lot of mobile dentistry. You do corporate mobile dentistry. You do school based. You do school special need. You also do whitening mobile dentistry, and you do also addiction mobile dentistry. Uh, so all of these services, which is actually more challenging, the most challenge that you've been into in terms of all of this mobile dentistry.
Well, from people that I spoke to, I would say the most challenging would be the special needs and then the addiction. Can you hear me?
Okay, yeah, and also we do have little problems with the audio. No, I cannot hear you, but I'm sure you can hear me. So we'll just continue with the questions. So pediatric mobile dentistry, there are you only offer simple procedures. This is a big one of the biggest questions that most of the dentists in the Philippines would be interested. How do you arrange the payment system in terms of who's going to pay, who's going to be charged, the institution, or how do you arrange the scheduling?
Absolutely. In America, we have Medicaid, which pays, and the families pay, and in my case, the institution pays.
Ah, really? Okay. I still I and also geriatric population. This is also one way, basically a great opportunity for all the dentists who would want to practice geriatric dentistry because in the country we do prosthodontics that we provide dentures. This is basically more of the treatment for the geriatric patients. But in mobile dentistry, especially geriatric mobile dentistry, you're basically applying all of like all check-ups. You go to the nursing home and you facilitate the dental education, right?
Yes, we do that, but we do a lot of dentures as well. We do a lot of dentures and partials.
Ah, yeah. Okay. So because we in the country we have a study conducted in 1998. It's also conducted in 2004 that there's a great population of 65 years old and above. So I think for all the dentists who are watching right now, this is a great opportunity for you. And also, you've actually tickled my interest, Sonia. I'm quite interested in probably looking into mobile dentistry, because in the country we have mobile dentistry, but these are supported by the government. So we do have several units, but this is specifically designed also for the government use. So when they do have like a dental mission, they go to different countries, different cities that move around and really provide services. But this is quite as based on the topic, it's a lucrative business.
We're happy.
Yeah.
Yeah, it's very lucrative.
So probably I'll get through you. I'll get your advice on how to do it.
And the mobile
Yeah,
whitening is
and because
becoming really big.
so what we're saying is just in the Philippines, based on my research, we do have almost 10 million 65 years old population. So it's a great market for us to get into, to all the dentists
Absolutely.
out there.
Absolutely. Great. 10 million. That's a lot of aging people.
So, Sonia, anything that you'd like to promote, anything that you'd like to share with us? Just a few more advices to Filipino dentists and for all those who are really watching all over the world. Can you your final inspiration and motivation, or probably advice to all of us and all the dentists?
I would just say don't don't turn a blind eye to mobile dentistry, and also any aspect. It doesn't necessarily have to be geriatric, and you can still keep your office and let this be a branch of it. Because once again I say some people may never walk through your door, but they will allow you to walk through theirs. So don't turn a blind eye to that additional revenue that you can have at mobile dentistry. And please, I encourage anybody to, if you have a phone, go to TED.com, Sonya Dunbar, and watch my TED Talk. I really would like that to go viral to bring awareness to the poor oral care in long-term care facilities. TED.com, Sonya Dunbar.
Again, Sonia, thank you very much. You're such an inspiration. You are such a beautiful individual, beautiful masterpiece. Say hi to your ex-boyfriend, your husband. And I'm so
Thank
looking forward to see you. I hope I'll be able to visit you there, or you
Come
coming
to our
over to
conference next
the
year.
Philippines, Manila, to share this information, because I think it's really really lucrative business. So we're really looking forward to that, and you have a blast. Stay home. My final question is how are you there? So how's the quarantine in your area, if you don't mind me asking there?
Well, we're still on shutdown. We're still in our homes. I think the Florida will probably be shut down maybe to the end of May. That's the projected. They just gave us another 30 days here, our governor. But we're great. I thank God for life, health, and strength. We only go out when we have to. I run every morning early, probably about 6, and then we're in the house. We order our food online and get it delivered, and we don't go out a lot at all. We're just trying to do everything we can to help the world heal, because we all need to heal from this and put a stop to this. So we're doing our little part and staying in. But thank you for asking, and you take care of you and your ex-girlfriend.
Okay, yeah. Okay. So yeah, we are all experiencing this, but it will end soon. It will end soon. So again, Miss Sonya, appreciate your effort. It's 11 o'clock there in Miami, Florida, and Florida. So thank you very much. Looking
Bye.
forward to see you. Bye bye. Bye, Sonya. So with that, we have again given you a great lecture how to have a lucrative mobile dental dentistry, at the same time focusing on geriatric dentistry. She was able to share with us some of the techniques, some of the tips, and some of the procedures, and how lucrative really is the business in the Philippines. So again, we have 10 million population, and 70% of those are 70% of those populations around more than 65 years old. So this is a great avenue for you to look into again. And again, watch out for more learnings. Watch out for more discussions with Dental Marketing Philippines. We are giving this no registration. It's all for free. All you have to do is just like the page of Dental Marketing Philippines, and you're gonna get more learnings, free webinar for all of the dentists, for all of the people who are really would want to have a good oral hygiene, good oral flora. So again, I'm Mr. Rochi Pirubis. I'm the founder of Dental Marketing Philippines. Maraming salamat po, and looking forward to see you and meet you all in your dental practice, in your dental clinic, and stay safe, guys. Bye-bye.